Puerto Rico and the Virgin Islands, and I've issued emergency declarations to support our response in both of those areas. So that's Puerto Rico and the Virgin Islands. This week, the storm passed just east of Florida. Got a little bit lucky, didn't hit Florida too hard. Working with the governor, working with everybody, but it did not hit directly, as a lot of people thought it might. It's currently off the coast of South Carolina, heading northward to North Carolina. Is expected to make landfall sometime this evening as a Category 1 hurricane. Very serious, a lot of water coming from that storm. I've already issued emergency declarations for Florida, South Carolina, North Carolina, and FEMA's personnel, and they are great. They're doing a job. They're already on the ground in all areas. Every single area that we mentioned is covered. Over the next several days, there's expected to be heavy wind and rain in the coastal areas of North Carolina, Virginia, Maryland, Delaware, and New Jersey. We're working with each of those states, and in particular as it relates to FEMA, the military, law enforcement, all of the different groups that are involved. Storm surge and inland flooding are possible, and everyone needs to remain vigilant until it passes. I encourage everyone to follow the guidelines of the state and local authorities. We're working with them, and I think the guidelines have been very accurate so far, so stay safe. Next, let me provide an update on the path forward for our country as we continue our war to defeat the China virus. We're beginning to see evidence of significant progress.
It is not a China virus. Viruses do not have nationality, and it is overgenerous to suggest that we are making a lot of progress. There is a sharp spike currently in 15 states and D.C. and Puerto Rico.
In hotspots across the South and West, we've seen slow improvements from their recent weekly peaks. Arizona's weekly case counts have dropped 37%. That's a tremendous drop, and the governor and the state have done a fantastic job. Down 37%. Texas down 18.7%. I was there a couple of days ago. And Florida, 21.2% drop. So that's a tremendous job that they're all doing. As we begin to contain the virus in these states, we must focus on new flare-ups in the states where the case numbers have risen, including Georgia, Mississippi, Tennessee.
So the president is misleadingly suggesting that these southern states that have been hit so hard are recovering nicely. It must be pointed out that Florida broke its record for single-day death tolls on 4 consecutive days last week. Arizona is seeing a horrifying number of cases, and in Yuma, Arizona, a small town on the border that President Trump visited recently and that happens to be home to my in-laws, more than 11% of the population has confirmed cases of the coronavirus.
Socially distance, wash your hands, wear a mask when you cannot avoid crowded places, and to protect the elderly. Very, very important. Protect the elderly. It's much different. Young children have very strong immune systems. We've learned how strong they are. But protect the elderly. The average age of those who succumb to the virus is 78 years old. That's the average age. It's important for all Americans to recognize that a permanent lockdown is not a viable path toward.
So the president likes to make these straw man arguments, suggesting that our choices are either reopening everything completely or having a permanent lockdown. That is a false set of options. What most countries have done successfully is a mixture of several things. Strong lockdowns, nationwide mask policies, a coordinated nationwide testing strategy, which the U.S. has never had, and using these together, they have been able to lower their number of cases and reopen successfully.
Very well with the vaccines and the therapeutics. Countries where they're there have been very significant flare-ups over the last short period of time are Spain, Germany, France, Australia, Japan, and also, as you probably heard, in Hong Kong, they've had some very serious flare-ups. Japan has gone, a lot of six-fold flare-up. That's a lot, but they'll get it under control. In our current phase, we must focus on protecting those at highest risk while allowing younger and healthier Americans to resume work and school with careful precautions. Ideally, we want to open those schools. We want to open them. At the same time, we're placing an emphasis on continuing to drive down the mortality rate with improved care, treatment, and medical interventions, building a bridge to the introduction of a vaccine. The vaccines are coming along incredibly well. Today, I'd like to also provide an update on the actions of my administration and the work that we've done. We're really taking an increased interest, and we're seeing numbers that nobody can even believe in terms of percentage increase. It's telehealth for American patients. The percentage increase is being worked on right now, but it's very, very significant, numbers that you would not even think possible. This has been a priority from the beginning of my administration when we launched an initiative to allow veterans to connect remotely with their VA healthcare team, and it worked out really well. We have a 91% approval rating in the VA.
So, hold on, I'm going to come back to you with more information in a second.
Now telehealth is a critical part of our path forward in the VA, and it's becoming a critical path, especially with our senior citizens. You don't have to go to the doctor's office. You don't have to go to hospitals. When the invisible enemy struck our shores, I took immediate action to eliminate regulatory barriers to telehealth, making it easier for patients to consult with doctors from safety and convenience. And really, they have great safety and great convenience right from their homes. Today, I'm taking action to ensure telehealth is here to stay. Moments ago in the Oval Office, I signed an executive order to make many of our regulatory reforms permanent. We've done some regulatory reforms that have had a tremendous impact on what we're doing, on medicine and medical and what we're doing. They can do things that you...
So just a couple things that I want to jump in with. The president has been comparing the U.S. response to other nations, suggesting that other nations are doing worse than the U.S. And with almost no exceptions, well, really, with no exceptions, that is not true. The U.S. has more cases and more deaths than any other nation. The president just singled out Japan. The U.S. has had about 150 times the deaths of Japan. The U.S. has a bigger population, but not 150 times the population. The U.S. population is about 2.5 times that of Japan, but the U.S. death toll is 150 times that of Japan.
Massive impact on prescription drug prices, in addition to the three other elements of reduction of drugs, particular prescription drugs. But the favored nations clause is massive. For instance, if Germany buys a pill for 10 cents a pill, as an example, just as an example, and the United States pays $2 for the same pill, we get the same privilege, the same right as they do. Never had that before. We paid all of the expenses, all of the research and development. So
part of what the president is saying here is true. The U.S. pays more than other nations do for the same prescription drugs. And it is also true that U.S. taxpayers fund much of the research that goes into making these drugs that then make a fortune for the drug companies. Now, House Democrats passed a bill to try to address prescription drug prices some time ago. Mitch McConnell has said that he will not act on it in the Senate. The executive order that the president has signed, he has claimed will lead to a 50% reduction in prices. The Associated Press says that that is false. No massive across-the-board cuts are in the offering for drug prices. The efforts announced by the president take time to roll out, and it remains to be seen how much they'll move the needle on prices.
Less than the United States has bought. How they allowed this to happen, representatives of our country standing at these podiums or in the Oval Office, how they allowed this to happen is just, to me, incredible. We've been working on this for a long time. I've been talking about it with Kayleigh for a long time, right? So now a governor like Ron DeSantis of Florida is doing a great job, or a great governor of Ohio, or a great governor of...
People in Florida do not believe that Governor Ron DeSantis is doing a great job. Multiple newspapers in Florida have been calling out his response, and an editorial by one of the most widely circulated newspapers in Florida this week begged for him to order a statewide mask requirement. And Shelby, when you have a chance, if you can grab me the title of that article, I would like to repeat it because it is so striking.
People, it lowers the price of drugs. So we have a series of 4 things that we signed, and you will see over a period of fairly short period, drug prices are going to be tumbling down at numbers that nobody would have ever believed possible. We have...
As I said a moment ago, the AP's analysis of the actions the president has taken are that it will take quite some time for the impact to lower the cost of drugs, and it is unclear that it will lower it by the amounts that the president has been suggesting. The House-passed bill to address prescription drug costs remains stopped in Mitch McConnell's Senate. And the title of the article that was written in one of Florida's largest newspapers was, "Help Us Out, Governor DeSantis, We're Dying Here." It called on DeSantis to issue a mask mandate across the state as it continues to suffer from one of the worst outbreaks in the country. The editorial states, quote, "Your refusal to impose a mask order, a requirement now in 32 other states, is out of touch with the mainstream. A Quinnipiac poll found that 79% of Floridians support a mask requirement, including 60% of Republicans. If that is not a mandate, what is?"
Mental health counseling, substance abuse treatment, which is a very big priority. We brought the substance abuse, at least prior to the China plague, or whatever you want to call it, we brought it down very...
It is not a China plague. Again, viruses do not have nationalities. If a nation were to claim this, it could be appropriately called the U.S. virus, because the U.S. has more of it than any other nation by an order of magnitude. Nancy Pelosi has labeled it the Trump virus, but its name is COVID-19.
Their telehealth, and they're all doing it. They're doing it gladly. Prior to the epidemic, or the pandemic, whatever you want to say and how you want to refer to it. But prior to the pandemic, the telehealth was fine, but it wasn't anything raging. And I guess one of the only good things that we've gotten out of this whole horrible situation is telehealth has been incredible. And again, the increases are, many hundreds of times greater than it was before. Do you have a number? It's like 2,000% or something like that. It's an incredible increase. You'll get the number, but it's I think they have it now finally, and it's really an incredible. Thank you, Kayleigh. We work with the leaders of major health insurance companies to ensure coverage for the telehealth visits related to coronavirus. We cut red tape to allow many services to be conducted by phone rather than video, which is much simpler, providing a much easier option for many seniors in particular. 35% of the Medicare beneficiaries who receive telehealth services, or over 3.6 million seniors, did so over the phone. So you're talking about 3.6 million seniors. That's something. 10.1 million Medicare beneficiaries have accessed care through telehealth since the beginning of the pandemic. So you're talking there, 10.1 million people. In April, over 43% of all Medicare primary care visits were done via telehealth, and compared to less than 0.1% in February. Those are part of the numbers that I think I'll have you get them. So this part you don't have to. You'll get the other section. Thank you. So think of that. Compared to less than 0.1%. 0.1%. That's an incredible number. So over 43% of all Medicare primary care visits were done via telehealth compared to, so you went from 0.1% to 43%. That's an incredible, it's an incredible number. The executive order I signed today will also expand healthcare access in rural America. We take care of rural America. It directs agencies to deploy strategic investments in our rural communications infrastructure. And we're working very hard with all of the people in government that are involved with the communications infrastructure so that the telehealth gets very quick and easy access. Additionally, revenue for rural providers varies significantly from month to month, making it difficult for many to stay in business. Many are having a very difficult time. To help fix this problem, my order will create a voluntary Medicare payment system that will give rural hospitals flexibility, really great flexibility, and a more consistent income stream to better serve their patients. Furthermore, I'm directing the Department of Agriculture, Department of Health and Human Services, and the Federal Communications Commission. We were just with the heads of each one in the Oval Office just before I came up to the podium to form a task force that will break down barriers to expanding rural health care. This order continues my administration's focus on rural health care. We allocated nearly $165 million through the CARES Act to support nearly 1,800 small rural hospitals who have done an incredible job, as well as $11.5 million to expand technical assistance for rural and underserved areas. We allocated another $10 billion to 2,000 rural hospitals and more than 2,400 rural health clinics. We waived burdensome licensing, certification, and registration requirements, which took tremendous amounts of time. And these are people that had great reputations and great track records for practitioners that serve on the front lines in rural areas, allowing more medical personnel to serve their wonderful patients. We're also, in terms of PPE, ensuring that the state and local areas have the supplies they need.
It is important to note, as the president claims credit for these investments in hospitals that are being made as part of the CARES Act. The CARES Act contained $100 billion to aid hospitals. Republicans tried to block that. Democrats fought for that, and specifically fought for the fact that it be directed at minority and rural areas that are most likely to be underserved. Also, the president has been talking about the advances of telehealth, which are powerful and good, but it is important to highlight that in the area of telehealth and internet connectivity, our systemic racial divides remain even more present than in other areas. A report from last year from the Pew Research Center found that 58% of black adults and 57% of Latinx adults have a laptop or desktop computer, compared with 82% of white adults. And according to a recent survey from Way Up, Black and Latinx job applicants are 145% more likely than their white counterparts to be concerned about their ability to do their job remotely. And the connectivity issues inherent in working remotely are certainly also present in seeking telehealth.
And we launched a national plasma drive last week. I was at the Red Cross building with the American Red Cross and 13 other healthcare organizations. I urge everyone who has recovered from the virus to go to coronavirus.gov, coronavirus.gov, and donate plasma today. We would really appreciate it. This really makes people better. But we need that beautiful ingredient that you that got better seem to have in your veins. You have to go to coronavirus.gov and donate plasma today. It would be tremendous. We really appreciate it if you do it, because we're low. We're low. We could help a lot more people, and it would be a terrific thing. It'll take an hour, maybe a little bit more than an hour, but everybody will be very appreciative. Makes people better. And, you know, you had something very special. You had something that knocked it out. So we want to be able to use it. So whatever you can do, coronavirus.gov. As a result of improvements we've made in treatment for Americans over the age of 18, the mortality rate has declined 85% from its April peak, 85% decline. On vaccines, last week we announced a $2.1 billion partnership with Sanofi and GSX to purchase.
So Dr. Fauci had pointed out that it is important not to get too excited about seeing declines in the mortality rate, because the mortality rate lags behind the infection rate. So as infections started spiking, the president kept saying, oh, well, it's fine that there are more infections because the deaths are lower. And Fauci warned, well, the deaths follow the infections, and we are in fact seeing that. We are back to seeing roughly 1,000 deaths per day. It had been down, but now it is rising again.
Companies, these are companies that are not only well-known, they're well-respected, most importantly. We're balancing speed and safety, and we're on pace to have a vaccine available this year, maybe far in advance of the end of the year, and
Well, that is not what most medical experts think. Dr. Fauci, testifying before Congress last week, estimated that the vaccine would be coming next year at best, not this year, not long before the end of the year, as President Trump is claiming now.
And he's very excited, and once we have the vaccine approved, fully approved, he'll start the process. They will start the process, and they'll get it out very, very quickly all over the country, and maybe beyond if it works as we think it probably will. By unleashing America's technical and scientific brilliance, we will end this pandemic, and we will hopefully end it very quickly. The therapeutics are very exciting to me, where you can go into a hospital, and whether it's through a shot or a transfusion, you take care of somebody and they get better. That's something to me is very important, and we're doing really well on therapeutics and really well on vaccines. So thank you all very much for being here. We'll take a couple of questions.
Thank you, Mr. President. So if I can ask your response to two items in the news and ask a COVID question. First, have you been briefed on the incident off the coast of California where the Marines and the Navy corvette hospitalmen appeared to have died in a training accident over the weekend?
They're actually briefing me in a little while. We have it scheduled for a little while.
And you hope to speak to the families?
Oh, it's terrible. No, it's terrible, and we'll be in contact with the families. A thing like that is terrible.
Separately in New York today, the city prosecutor confirmed a criminal investigation into the Trump Organization. Do you have any reaction to that?
Well, I just heard about this. Is just a continuation of the witch hunt. It's Democrat stuff. They failed with Mueller. They failed with everything. They failed with Congress. They failed at every stage of the game. This has been going on for 3.5, 4 years. Even before I got in, this was starting with the Mueller deal.
So the president is saying a number of misleading things here. First of all, the Mueller investigation certainly did not fail. It resulted in 50 indictments, convictions, and guilty pleas.
First witch hunt in American history, and there's nothing that I know even about it. You know, I had seen that today, just a little while ago, and I said, what's this all about? I know nothing about it, but it's just a continuation of the witch hunt. Didn't work out for Congress, didn't work out for Mueller, didn't work out for anybody, so what they're doing is they send them around to all over the country, I guess, maybe. But it's a terrible thing that they do. It's really a terrible thing. The witch hunt has gone on long enough, okay? What else?
And just one on COVID, you mentioned the vaccine.
Again, we're going to put a video into the comments listing all of the indictments, convictions, and guilty pleas that this so-called witch hunt turned up. If this is a witch hunt, it is a witch hunt that found many, many, many witches.
Nothing to do with, we want to make people better. We want to send them to the areas that most need it. And I think we're going to have something very soon. It's going good. Jeff?
Mr. President, you said today in a tweet that Dr. Birx was taking bait. from Speaker Pelosi. What did you mean by that, considering that she was just describing the facts about the case of the pandemic right now across the country?
Well, I think we're doing very well, and I think that we have done as well as any nation. If you really look, if you take a look at what's going on, especially now with all these flare-ups on nations that they were talking about.
It is simply not true to suggest that we have done as well as any nations, despite the fact that we had more time to prepare than Europe or Asia had. We have more total cases and more total deaths. The U.S. has only about a fifth of the world population, and yet it accounts for about a quarter of the world's cases and deaths.
They do come back, but I think we're doing very well. I told Dr. Birx I think we're doing very well. She was in my office a little while ago. She's a person I have a lot of respect for. I think Nancy Pelosi's treated her very badly, very, very badly, very nasty. And I'm just referring to the fact that I thought that really they should say the job we've done, whether it's on ventilators or testing. We've tested now over 60 million people. No other country is even close to that. We've tested 60 million people with great, in many cases, about 50%, meaning.
The problem that is happening with the testing, because suggested that people who wanted to do lockdowns permanently, the point of the lockdowns was to slow measures in place to prepare for it, such as getting a nationwide system of testing in place. This has not happened. The number of kits in most areas has become possible to do a large amount of testing. The lab has still not caught newsroom who are located in up to 200 or helpful.
The tenant doesn't have the value. Well, we're sort of, in a certain way, the lease. We make it possible to have this great success. TikTok's a tremendous success, but a big portion of it's in this country.
From the sale directly.
It would come from the sale, yeah. Whatever the number is, it would come from the sale.
And then you
Which
mentioned
nobody else would be thinking about but me. But that's the way I think, and I think it's very fair.
And you
But
mentioned
we want no security problems with China. It's got to be an American company. It's got to be American security. It's got to be owned here. We don't want to have any problems with security, etc. And something could come out. I will tell you, there's a lot of excitement, not only by Microsoft, but by other companies in terms of buying it. So we'll see what happens. But we want, and we think we deserve to have a big percentage of that price coming to America, coming to the Treasury.
then on the negotiation on Capitol Hill, you expressed some frustration and said you might take executive action to address.
Might do that, yes.
So I was wondering if you could talk about both how you might prevent evictions through executive action, and then also
Yeah, I can do that if I want, and I want to do that. I don't want people to be evicted, and when they're evicted, when they're thrown out of their, whatever the place may be, in many cases they go to big shelters. And if you talk about pandemic, this is a pandemic, and they go to shelters. Number one, they're thrown out viciously. It's not their fault. It's China's fault. It's not anybody's fault. It's China's fault.
It is not China's fault. Our nation is uniquely responsible for our uniquely poor response to this virus. Now, in terms of the eviction crisis, there is indeed a crisis because although the House passed the HEROES Act over 2 months ago, which would have extended eviction protections, Mitch McConnell's Senate allowed eviction protections to expire. And we have a situation now where some 28 million Americans, disproportionately black and brown Americans, are at risk of eviction.
And we don't think that's fair. You understand that. You've heard it before. Yeah, please go ahead.
Thanks, Mr. President. I wanted to ask you about the Justice Department sending federal agents into cities like Chicago as part of Operation Legend. How exactly do you envision these federal forces working alongside local police departments to help stop violent
It's
crime?
not a mass send, but it's sending very talented people to help them with the drugs and the shootings and the guns and the things that are happening. It's not like sending in the National Guard and stopping it cold, which is an example. A lot of progress has been made in Portland, but, frankly, sending in the National Guard like we did in Minneapolis, it stopped it cold. From the time we sent that National Guard, they walked down the street. It was over in Minneapolis. Now it may be starting up again. These are Democrat-run cities and states, and it hasn't been a pretty picture to watch. We will help Chicago. We'll help New York if they have to request the help. But we want to stop the drugs. We want to stop the guns. A lot of the Chicago is guns, but what it is drug-related, gang-related, largely gang-related. With ICE, we send out thousands of MS.
Well, the president is correct that Chicago has a problem with gun violence, and as the mayor of Chicago has often highlighted, the problem is largely due to the fact that even though Illinois and Chicago have relatively tight gun laws, they are surrounded by states like Indiana that have very weak gun laws, and the majority of guns used in crimes in Chicago were purchased legally in Indiana. And we're going to put a video in the comments on that topic as well.
National election.
Yeah.
Are you considering at any point issuing an executive order addressing mail-in ballots, and why do you think some people are pushing it so hard?
Well, there's never been a push like this for mail-in ballots, and if you look at the New York congressional race, which is a disaster, Carolyn, it's been a total disaster. They're 6 weeks into it now. They have no clue what's going on. And I think I can say right here and now, I think you have to rerun that race because it's a mess. Nobody knows what's happening with the ballots and the lost ballots and the fraudulent ballots, I guess. I think you probably have to take the Carolyn Maloney race and run it over again. How can you do this? And this is a small race with literally thousands of people.
So I have to jump in here. So first of all, there is no evidence of fraudulent ballots in New York. Voter fraud is virtually non-existent in the U.S. The Brennan Center for Justice in 2017 ranked the risk of ballot fraud at an infinitesimal 0.00004% to as high as 0.0009%. Now, in New York, there is a particular problem, and that is that mail-in ballots typically in New York have been required to be received by the election day. And therefore, the postage-paid envelopes no one is worried about whether there's a postmark on them. Postage-paid envelopes typically don't have a postmark. Now, in this case, the ballots had to be mailed by the election day. And because of that, it is hard to tell if they didn't get a postmark whether they were mailed by the election day or not, if they were received after the election day. What this highlights is not that mail-in voting doesn't work. In fact, 5 states use exclusively mail-in voting, and it works very smoothly. What it highlights is that if a state is going to go to large-scale mail-in voting for the first time, it needs some time to prepare for that. And that is exactly why, instead of poo-pooing mail-in voting, it is essential to invest now in mail-in voting and figure out how best to apply mail-in voting, because no one should have to choose during a pandemic between protecting their health and exercising their right to vote.
To 7 days later. Well, if the vote's going to count 7 days later, that means if it depends on the one state like Nevada, that would mean simply that you can't have, supposing it's down to that one state, it could be, it's a great state, but supposing it's down to that one state, that means you have to wait 7 days. But they won't have it there. This is something that's so messed up. And by the way, I have to say, the post office for many, many years has been, run in a fashion that hasn't been great workers and everything, but they have old equipment, very old equipment. And I don't think the post office is prepared for a thing like this. You have to ask the people at the post office. But how can the post office be expected to handle? They have regular mailing, and then now on top of that, they have the internet, where you have Amazon and these companies doing, all the buying. Instead of going to a department store, they go buy through. So you have massive numbers of purchases now going through the post office, purchases of items and gifts. And that's a tremendous strain on the post office. The post office loses a fortune. It has been for many, many years, for decades. So now on top of it, it has this. And the Amazons of the world and the others, they pay very, very little money. They lose money on the post office loses money.
This claim that the president keeps making is false, that the post office loses money on every Amazon shipment. It's not true. Amazon does not have a special deal with the Postal Service, as President Trump has claimed, and it is in fact profitable for the Postal Service to deliver Amazon packages.
This massive plan out of nowhere to take millions of ballots and send them all over the place. You'll never know who won that state. It'll get messed up just like New York and just like Paterson, New Jersey, and just like many other places. In West Virginia, they indicted a postman for doing something very bad. You know that? But there are many cases all over the country. If you look, you'll be able to find. There's a list of them all over the country, and that has to do with universal mail-in. Again, absentee is great. It works. Like in Florida, they'll do absentee. It really works. But universal mail-in ballots is going to...
So absentee ballots and mail-in ballots are the same thing. It is two names for the same thing. And the reason that President Trump is saying that absentee is okay is because that's how he votes. That is how he voted in the primary and in the last election. And so he's saying that it's not fraudulent when he does it, but it's fraudulent when other people do it.
Doing that in September. We'll be doing sometime during this month the health care plan. And I think that'll be before the end of the month, and I think it'll be very impressive to a lot of people. Thank you very much. Thank you.
The Postal Service says it has capacity for the election year. Mr. President,
All right, so what the president said about the Postal Service and about mail-in voting is more false than I have the opportunity to get into here. We will be making a series of explainer videos regarding mail-in voting to try to set the record straight on those facts. Also, at the end of this event, President Trump made a reference to the health care plan that he is supposedly rolling out. He had said 2 weeks ago that he would be rolling it out in 2 weeks. And it has been 2 weeks and he has not rolled it out, and now he's suggesting that it will be out before the end of the month, which is a little bit more than 2 more weeks. We've made a video in the past highlighting that the president frequently suggests that plans are coming in 2 weeks, and when he says that, they usually are not. At the end of 2 weeks, they're still coming in 2 weeks. It is a little bit like Little Orphan Annie singing about tomorrow, which is always a day away. So that was today's press conference from the President of the United States. I had the support today of our whole newsroom, but most particularly Alex Rabinowitz and Shelby Vacalin. Wherever you are, please stay safe. Please take care of the people that you love, and please take advantage of this time to make sure that they know how much you love them. We are going to get through this thing together. For now, I am Alan Piper. If I did not address your questions and your concerns, please tweet them at me at apiper13, and I will attempt to either address them directly with you on Twitter or in our next broadcast. Thank you for tuning in. Be safe and have a good evening.